Hi, my name is Ibra Farga and I am a 2020 graduate from the Department of Healthcare and Hospital Management, Jamia Hamdard. First of all, I would like to thank all the staff of Jamia Millia Islamia to give us this opportunity to present our papers at the IMC 2021. So basically, I have done this study with the help of my professor from the same department and the same school, and her name is Dr. Ifat Naseem. So we have done this study on the assessment of maternal stress due to COVID-19 on mothers who have children aged below 10 years. Let me introduce this topic to you. The COVID-19 pandemic and the regulations that were set in many countries to prevent its spread have affected many lives around the world. It had a great impact on various population groups. It changed the family commitment. It increased the childcare duties, which reportedly had affected the mothers who had children aged below 10 years. All these family commitments and increased duties increased the mother's stress levels because this pandemic, it had altered daily routines due to forced isolation and fear of the child getting exposed to the deadly virus. Anxiety has spread among mothers who have children, including unpredictability of when normalcy is going to return, worries about combating the virus or of their child getting sick, how long isolation will continue, and abandonment that has been caused by this isolation. All this is leading to negative overthinking. So if you talk about news channels and social media, they have focused excessively on the implications of the virus concerning the physical health. The guidelines include social distancing, wearing masks out in the public, and restricting outings to only essential matters. However, mental health is something that has been overlooked, and it has accompanied the pandemic. The feeling of anxiety and stress are ordinary human responses which, when people are in a state of danger or threat, happens. And this pandemic has caused extensive despair and feelings of vulnerability among mothers who have small children. So this study basically aims to determine the stress on the mothers who have children aged below 10 years, the challenges they are facing coping up with the current scenario, which is leading to physical fatigue and emotional as well as mental exhaustion. Now, the rationale of the study is that the children who are aged below 10 years, they are very vulnerable to catch the diseases as they have a weak immunity. They are not sensible enough to follow proper sanitization instructions. They have a habit of touching their faces all the time. Small children are mostly absent-minded in nature, and the children, they are guiltless and they actually do not know what COVID-19 is and what its adverse effects are. So this is leading to plenty of trauma to the parents and especially the mothers, as children are not mature enough to take care of themselves. So this is why we wanted to analyze this topic and research what actually the society thinks about the disease, and are the mothers of small children really facing strain and suffering due to the current situation. Bohr in 2016 in one of his studies on maternal stress said that as paternal stress has been associated to harsh parenting, maternal depression, a poor cognitive, emotional and physical development in children, and may have long-lasting effect on the well-being of both the mother and the child. So now let me talk about the research methodology that we used. So this was basically a cross-sectional observational study based on both primary and secondary data carried out in India. Snowball sampling technique was used, and an online semi-structured questionnaire was developed using Google Forms. Link of the questionnaire was sent through WhatsApp and emails to the contacts of the investigators. The invitation to participate in the questionnaire was sent to mothers who had small children, basically by contacting them individually. All the mothers of children aged below 10 years who were currently living in different locations in India were eligible to participate. The data collection was initiated on 10th June 2020 at 8 p.m. IST and closed on 14th of June 8 p.m. IST. The online self-reported questionnaire developed by the investigators contained the following sections related to attitude, anxiety and perceived mental health care, and physical healthcare needs during the pandemic of the novel coronavirus. And the answers of the questionnaire were assessed with the help of a 4-point Likert scale, which had like 4 options. The rating was done as follows: strongly agree, agree, disagree, and strongly disagree. A descriptive statistics has been used in the study to analyze the findings, and mean and standard deviation and proportions have been used to estimate the results of the study. Now, the objectives of the study were to study the stress levels of mothers who have children aged below 10 years during the COVID-19 pandemic, then to study the parenting difficulties faced by mothers who had children below 10 years during the COVID-19 pandemic, and to study the challenges and approaches of mothers towards the eradication of COVID-19 pandemic. Now, if we talk about the data analysis and result, first of all, we had divided it into 2 assessments. First was the mental assessment, the second was the physical assessment. So the mental health assessment had some question that contained that was the mother feeling cheerful when the child was at home, and was the mother feeling mood swings during the COVID-19 situation? Did the mother socialize less with friends than she used to because of her child? And then was she confused and scared of sending this child back to school due to COVID-19? And was she scared to take her child outside to play during the COVID-19 situation? And was she facing difficulties to make decisions? And was her memory and concentration debilitated? Then was her self-morale and self-confidence lowered and than it should be during the situation? So if we talk about these results of the mental health assessment, there were 81 respondents in total, out of which 97.2% were cheerful when their child was at home with them. 92.6% respondents faced the issue of frequent mood swings. 96.3% did not socialize much after isolation. 97.6% were afraid of sending the child back to school. 98.8% of the participants did not take the child to play outside. And 97.6% were scared to take the children to the hospital if they felt sick. 99.4% were extra cautious about the health of the child now. 97.6% did not call the helpers at home and were doing the household chore all by themselves. 91.3% felt that life had become monotonous after the COVID-19 situation. 98.8% of the mothers did not leave the house much. 96.2% were extra cautious while buying from outside, and 98% agreed that they were doing a good job as a parent. 2% felt that they were not able to do justice to their course. 95% viewed the future positively, but 5% were negative about the future. 89% felt that their memory was debilitated and were facing difficulty in taking decisions. 89.7% felt that their self-confidence and morale was lowered. 97.5% had to take extra care of themselves. Altogether, these participants, they reported high levels of stress and fears regarding their children's health, including doubts regarding their own health. Mothers of small children during the pandemic reported high levels of stress, physical fatigue, and worries regarding the child's health and behavior. Most participants stated that the pandemic was currently affecting their lives and mental health. It can be clearly noticed that the isolation period and the monotonous life and lack of help in the household is leading to a lot of mental trauma and physical fatigue at home for the mothers. Now, if we talk about the physical health assessment, we talked about the bloating of the stomach. We talked about feeling fatigue when the mothers woke up in the morning, and many other questions like this. So the results were like there were again 81 respondents, out of which 87.5% experienced stomach bloating. 88.9% experienced drowsy or feeling sleeping. 89% experienced fatigue and were not well rested when they woke up in the morning. 87.3% experienced frequent muscular aches, especially in the head, neck and shoulders and lower back area. It could be clearly seen that the lack of motivation and focus from the mothers' lives and escalated household duties were leading to physical ailments for most of the participants. Now let's talk about the results of the physical health assessment. 87.5% experienced stomach bloating, 88.9% experienced drowsy or sleepy feeling, 89% experienced fatigue and were not well rested when they woke up in the morning, 87.3% experienced frequent muscular aches, especially in the head, neck, shoulders, and lower back area. It could be clearly seen that the lack of motivation and focus from the mother's life and escalated household duties were leading to physical ailments for most of the participants during isolation. And altogether, the participants reported high levels of stress and fear regarding their children's health, including doubts regarding their own health. Now, let's do some discussion. The pandemics and epidemics are a periodical phenomena, and people in the society face several challenges during such periods. Lack of awareness often leads to an apathetic attitude, which may adversely affect the preparedness to meet these challenges. Impact of these epidemics and pandemics are often very severe, which may adversely affect the mental well-being of a given population. The fear and the anxiety related to the epidemics and pandemics also affects the behavior of the people in the community. Hence, the study attempted to evaluate the awareness, the attitude, anxiety, and perceived mental health care needs of the mothers of small children in the society. These findings in the study also suggested that the isolation at home, physical distancing, and closure of educational and supportive institutions for children have affected their mothers' moods, behaviors, emotional disturbances, motivation to perform work at home, and apathy. Mothers should also stay connected. Gaining the support and care of others is a powerful force for good in helping us to cope up with challenges. Spending time with family and supportive friends can bring a feeling of comfort and strength. Talking about our worries, thoughts, and feelings can also help us to find practical ways to think or deal with stress. And the mothers, they can also plan activities to pass their time, and with kids being out of school and parents being out of work from working or working from home, routines are basically thrown out of the window. But we can always keep our families morning, meal time, and bedtime routines consistent. This will give the mothers kids a sense of consistency, and it will help them too. So this was all about the research. Thank you so much.